MyGreat28. It's hard to believe we're on week number 7 of our series, but tonight's going to be a lot of fun because we're going to hear from all the doctors on the health panel. And this is what we're going to be talking about. We're going to be talking about measuring your success. And what does success mean? It's the achievement of something desired. Having said all of that, the scale may or may not be your best friend. And this, I want to show you this one cartoon because for me, this cartoon is probably what I thought my entire childhood, whether it was dance instructors, my mom, my sister, my friends. I love this. It's just don't step on it. It makes you cry. And that's what I always thought of scales my whole life, but not anymore. And so with all of that being said, I hope that gives you a little smile as we go into our holiday week, and so many people are having so much success here on the program. I'm going to turn it over to Dr. Gregory Koldonic. Dr. Greg is going to walk us through while that cartoon does not have to be the truth for you anymore. So Dr. Greg, I know you're with us. Take it away.
Thanks, Woodson, and it's my pleasure. And, you're right. The scale really only is, part of the picture, part of the equation. And, I mean, we all have a weight. We all weigh something. But, it really matters, where that weight is and how, how that weight is sort of divided between our fat and our lean body mass, which for most of us is, the difference between fat and muscle. Now this picture really sums it up quite nicely because these are models, these are rubber models, and they each represent 5 pounds. 5 pounds of fat versus 5 pounds of muscle. So you can see that muscle, pound for pound, is substantially smaller than fat, okay? And so you can actually lose fat and gain muscle in such a way that your weight doesn't change, but your total body fat percentage decreases, and you're going to feel better, you're going to look better, you're actually going to be burning more calories. So let's move on to the next slide. I think that shows this is the same woman, okay? And you can see that the picture on the left, this woman weighs 127 pounds in this picture, but in the other picture on the right, she actually weighs 9 pounds more, But look at her. I mean, you could see quite clearly that the waist is smaller, the hips are probably smaller, her thighs are smaller, her calves might be a little bit smaller. The only thing that looks a little bit bigger maybe are the arms. Her guns are a little bit bigger. But when you do her measurements, you're going to see a dramatic decrease in the total number of inches spread out over her whole body there, even though she's weighing more. And look at the posture. Look at how she's holding herself. Okay, the woman on the right is feeling a whole lot better about herself than the woman on the left, even though they're the same people. So let's move on. Both fat and muscle are metabolically active. Okay, and this slide really says a lot here. 5 pounds of fat burn about 20 calories per day. That's just sitting there. That's just resting. Whereas 5 pounds of muscle burn 250 calories a day. That's over 10 times the amount of calories pound per pound that muscle burns over fat. Not only that, like I said, both of these tissues are metabolically active. Fat, it causes a lot of hormonal changes. It increases insulin resistance. Its sole purpose is to store calories, okay, in the form of fat, all right? And as you accumulate fat, it gets better and better at doing that, okay? Muscle, on the other hand, it can store calories. It can store calories in the form of glycogen, okay? Glycogen is a sugar-like substance that's stored in the muscle and the liver. This is sort of a limited capacity. Muscles and liver can only store a certain amount of glycogen. Fat, on the other hand, can keep storing fat, forever and ever, and there is no limit. Okay, the only way you can actually store more of those carbohydrates, okay, in the form of glycogen, a very readily utilized fuel, is to actually carry more muscle. So the more muscle you have, the more glycogen can be put away for immediate use as fuel, okay, and it's not going to be stored in the way of fat. So if you have a greater proportion of muscle to fat in your body, guess what? If you overdo it on carbs a little bit, those extra carbohydrates are going to be stored as glycogen. If you move around a little bit, that glycogen is going to be utilized as fuel, and guess what? You got more storage capacity for a few of those extra carbs. Okay. Now, in addition to that, and I said it earlier, muscle doesn't sag. Okay, muscle is firm, it looks good, and it helps you look better. Okay, your posture is better, your form is better. Fat, we all know, it does sag. Okay, and so muscle looks a lot healthier, it makes people feel healthier, and guess what? It is healthier for you. Okay, so let's move on to the next slide. And I really do like this slide because the BMI, a lot of people don't know what the BMI is, but the body mass index is just a way of taking height out of the weight equation. Okay, so if you were going to take slices of yourself, crosswise, okay, each slice, okay, using the BMI method of calculation, weighs the same. Okay, it's the same amount of weight per unit of height, and that's all that it is. Okay, now we look at the gentleman on the left-hand side, and I've had a patient like this exactly. I mean, he was a retired sheriff's deputy. Okay, he was about 64 years old. He was 5 feet 6 inches tall and weighed 205 pounds. Okay, well, we automatically do a BMI calculation in the office. When I looked at his BMI, I laughed. It was 33. And I told him, I said, look, according to the BMI scale, you're obese. Okay? And he looked at me and he started laughing too. Because if you took and grabbed the skin of around his waist, I mean, you couldn't grab it. I mean, it was that tight. Okay? So there wasn't anything to pinch there. If he had a total body fat percentage of 7%, that would be an overestimation. Okay, now compared to the guy on the right, okay, the guy on the right, same height, same weight, okay, same BMI. Okay, so the BMI, while it's slightly better than weight, plain weight on the scale, it really doesn't give you much of a better estimate of exactly what's going on. Okay, so it's the total body fat, it's your lean body weight, okay, which really matters. So we see this all the time. People in the program, they'll lose some weight, and then they sort of stall. They're feeling better. They're exercising a little bit more. They're moving more. They're eating properly, but the weight sort of stalls. But when they take their measurements, they notice that their measurements, have dropped dramatically, or they've lost 1 or 2 sizes, pant sizes or dress sizes, and that really, should tell anybody or everybody that things are moving in the right direction, even though the scale isn't necessarily indicating that. Okay, so the goal here is to get healthier. Part of that process is going to be a loss of weight for most people, but more importantly, it's going to be a shift from fat to muscle, okay, which is going to be healthier for you. You're going to burn more calories. You're going to be more active. You're going to feel better, and so that really is, the true essence, the true purpose of this program. Okay, so don't get hung up on weight. Okay, look at the bigger picture. So I'm going to pass the stage over to Dr. Mike, and I'm looking forward to hear what he has to say.
Yeah, and thank you so much, Dr. Greg. And I'm telling you, I could not imagine how many screenshots were taken, including me taking a picture of the resting, basically muscle burning 250 calories at rest versus fat just sitting there like a big blob of blubber. I had no idea that that was going on inside of us, the difference between the two. That's amazing to me. That's shocking.
A good way of thinking about it is fat just goes along for the ride. It's the muscle that's got to carry it. So the muscle's doing the work, the fat is just going along for a ride.
I'm never going to forget that, and that muscle doesn't sag. I love that. All right. I think I need to get that on a shirt. All right. Dr. Mike, I know you've got something in store for us, and we're so excited to have you here with us tonight. Thank you so much. And so, Dr. Mike, tell us what you've got in store for us.
Thank you very much, Woodson. Can you hear me okay?
Oh, I hear you great, loud and clear.
And in case I do come into a coughing spell, my apologies in advance. I am recovering from a respiratory virus. I seem to be doing okay, but you never know about these things. So we're going to segue from the clinical side of things. We talked about the scale not necessarily being your best friend. Dr. Greg did a very, very good job of highlighting the different components of what goes into the weight. Summarizing it with the BMI, the body mass index, may in fact be misleading. So that is all very useful information, but that sort of sits in the clinical realm. So now we're going to take it out of the clinical area and put it into the ordinary world. Why did you start on this program anyway? It could have been that you were health conscious or health issues were forcing a change. It could be because you wanted a different level of fitness. Could have been something to do with clothing and the costs of clothing. Appearance, and this is that time of the year when there are lots of parties and a fair number of reunions. You may have wanted something different. You want your friends to see something different, or your classmates from way back in the day. You wanted them to see something different than before. Or you were going through some major life changes and you just needed a reboot. Whatever the case may be, one of those things that you need to keep in mind is if you started out because you wanted to get fitter, then don't necessarily use the scale to measure your fitness level. Measure your fitness level, and we'll come to that specifically in a few seconds. Now, the next slide, taking the same amount of information and the same line of thinking, have you reached your goal? If what you wanted was to knock down your fasting blood sugar and you've gotten it to a healthy range, well, good, that's a measure of success. If you haven't, your blood sugar is still coming down, but it's not quite where you want it to be yet, well, then good. You've had progress, but you're on your way to success. If it's the appearance that you're more concerned about, then great. There are things that you can do to keep on track rather than constantly obsess over this number on the scale. So specifically, let's talk about health as a goal and how to measure success if health is in fact what you're looking at. It could be from what we call biometric markers. Has your fasting blood sugar improved? Has your fasting blood sugar gotten back to the point where you're no longer in the diabetic range? It could be because you wanted your cholesterol levels to improve. The HbA1c, or the glycohemoglobin, that's a longer range measure of diabetic control. That may have been improved already or have been pushed into the non-diabetic range, in which case that's a success. I have a client who has a fairly high C-reactive protein, and she discovered it, unfortunately, the wrong way following a stroke. So her goal was less to lose weight than it was to change her physiology enough that her C-reactive protein would go down, and it has. So she's only lost a grand total of 11 pounds, but she has achieved success because her risks for future strokes have been brought down markedly. It could be that you're having symptoms. SOB stands for shortness of breath. Bendopnia is a fairly new term that was coined into the medical literature. It literally means getting short of breath whenever you bend down. And there are lots of folks The most common way that this manifests is they cannot tie their shoelaces. They literally lose their breath as they lean down to tie their shoelaces. It could be dizziness, it could be brain fog, it could be pain and inflammation, it could be fatigue. If all of these symptoms were what brought you into the program and these symptoms are improved, then you've had success. So it's not necessarily just about the scale. So let's move on to the next slide then. A fitness individual, somebody who wants to compete. I have a client who was less interested in losing weight than he was in losing body fat percentage. He wanted to lose a certain amount of body fat, and he consequently wanted an increase in muscle mass. And we helped him achieve both goals in 5 weeks. Now, the irony of the situation is he actually gained weight on the way to his success. Now, because he is a competitive athlete and he lifts weights, he goes to the gym on a regular basis, and he wanted to compete in a 5K, the gaining of the weight was not a big deal for him because he knew that he had gained muscle. And in fact, it translated to his 5K time. He just ran the 5K. He thought he was just having a nice day, an enjoyable 5K. He hadn't run a 5K in over 8 years. Turns out he comes in second in his age group. And the only reason that was possible was because of the extra muscle mass that he put on. Now, had he been concerned about the number on the scale, yes, he might still have finished the 5K, but he might not have come in second in his age group. So, moving on to the next slide, we highlight a few fitness goals. It could be that you want to be able to play with a child, your daughter or your son, grandkids, or you might want to coach youth sports. Or you might be like this one individual that I was coaching. He wanted to compete yet again in a 5K, and although it was his first time back out running, he actually came in with quite a good time and came in second in his age group. It could be that from a competitive standpoint, bodybuilders, you need to reduce your body fat percentage. This program will help you with that. It could also be that you're recovering from an injury or an illness. My specific story is I had gained weight because of sports injuries, and I could not exercise my weight down. So I was able, using MyGreat28 products, I was able to get the weight down, but more importantly, now that I'm not lugging along 15 extra pounds, I can actually do most of the physical activities that I used to before my injuries. So fitness goals can be very, very good indicators of success on this program. Now, we come to one of the biggest goals for a significant number of people out there, and that is they want to look good, especially in clothing. So the next slide shows that, and anyone who's ever tracked fashion understands that fashions never really go out of style. They just come and go. If you really had a perfect world, you'd have a house-sized closet where you could keep all your clothes from about your late teens and going forward, because those things become vintage clothing and they're quite expensive the second time around. So the next slide shows this quite nicely. It might actually be cheaper to just keep your old wardrobe, or, especially this time of the year, there might be a new style that you really, really want and it needs a few pounds off. Now, whether the pounds come off in the form of fat or your shape changes because you put on muscle, you can fit into a different style, and that would be a measure of success. It could also be that you finally come to grips with the fact that you cannot accept that you are now a size, whatever the number may be, and you want to get back to a particular number, whatever that number might be. So regardless of what the scale reads, if you started out at size X and you got back to the size that you wanted to be at, well, that's success, regardless of what the scale says. Next slide talks about appearance, and this is that time of the year. It could be family events, birthdays, weddings. It could be the Thanksgiving party, dinner that everyone's going to be going to. This time of the year in the medical community, and I'm sure for a lot of other organized companies, there are Christmas parties, and this might be the time of the year that you want to wow everyone by being able to fit into that ball gown that you have always loved but could never quite fit into. Coming up to the next part of the summer of the year, it could be the swimsuit that you've never been able to get into. Whatever the case may be, these are real-life scenarios. These are not dependent on the number on the scale. And then lastly, there's always the situation where you've gone through a few life changes, you're ready for a few different things, and you wanted to change things around a little bit. You might be leaving for college, and this happens to strike fairly close to home for me. Every time I left one area of education, when I left high school for college, when I left college for med school, I looked on it as a chance to reinvent myself. So in high school, I was known as the jock. In college, I decided I was going to be the brain. In med school, I decided I was going to be both. But it allowed for me to reboot myself. Now, granted, I did not have weight issues back then, but if you're going through one of these changes today, this might be the perfect time to address certain things. Weight might be one of them. Fitness might be another one. Strength might be another one. And use the system, MyGreat28, to achieve your goals and achieve success. You might be leaving for college and you were the kid in high school who was never much of an athlete. Well, this might be the way to get it done. Or you might be leaving college and you want to shed a few extra pounds so that you're competitive when you go for your job interviews. Or you're getting a new job and you want to impress your new bosses the first day, the first week, the first month. Or you've lost your job and you want to get your mojo back. There may be relationship changes, and this is probably one of the biggest drivers of a desire for a change overall. Now, it's neither good nor bad, it's just these are natural places where people will say, you know what, I'm going to make a change, I'm going to do this. And however those changes occur, if that was what brought you into MyGreat28, keep that goal in mind, because that's how you should define success. Not some arbitrary number on the scale, not some concept of what constitutes appealing or sexy, but rather what you came for. Go get it. Go get your success.
That is fantastic. And that is so true. There's so many different reasons why we all want to make those changes. I love that. That was very, very wonderful and very, very interesting. And I know a lot of people, including myself, made me think about, gosh, going into the holidays and coming out and getting ready for next year with all kinds of New Year's resolutions getting ready to happen. So that was wonderful. Well, Dr. Elvira is with us now. And Dr. Elvira, we're so excited to hear what you have in store for us to wrap up the presentation.
Well, thank you. Good evening, everybody. Can you hear me well?
Yes, hear you very well.
Okay. Well, you know, after Dr. Greg and Dr. Mike, I better try to do something really more positive. Well, they're wonderful. And it is true. These are very difficult times and of the year when we are going to parties and family gatherings, and there's always a lot of food around that. But we know we have made a commitment, and we, for whatever reason, and Dr. Mike mentioned multiple reasons, and they're all real facts of life. We do make decisions based on real things. So we are what we repeatedly do. Excellence, then, is not an act, but a habit. What does this mean? You know, we need to lead our life by example for everything we do in every aspect of our lives. That could be career, it could be motherhood or parenthood, it could be different type of goals, including your health. And health is one of the things that we have to also stand by once we make a decision and lead by example. It's like what we tell our children. We could nag at them and tell them, don't do this and don't do that. And you know what? The children learn more for what we do with ourselves as a person than what we tell them. So we have to lead our lives by example. So we talk the talk and walk the walk. We set into a healthier lifestyle, and this is what we have to do. What decision we have to make? Well, whatever your health issue, whatever your weight issue, whatever reason you had into making the decision of getting into MyGreat28 and starting a weight loss program. And this is a fantastic clinically proven weight loss system that is here to help you. It is not a short-term deal. It is a long life-term decision. So you're going to do this for life. What are you going to do for life? Well, you made the decision already. You enroll into MyGreat28, which is proven as a great, healthy way of losing weight, guided by physicians to talk to you in a sensible way, how to make changes, how to get rid of the saggy fat and go to the muscle. I love that too. What's in Dr. Greg was fantastic. Muscle does not sag. And that's part of what we need to do. We need to change our bodies into a healthier body. It may take longer for some people. It's okay. It's fine as long as you are walking towards your goal and you are staying firm at it. So people tell me all the time, well, I don't have time to exercise. Well, I work 2 jobs, 3 jobs. And yes, we can't beat everybody up and say, okay, you have to work a full hour. Well, in reality, many people do not have a full hour because they have 2 or 3 jobs. So we have to look what really works for us and stay focused on that. Okay, half an hour of a very good strenuous cardiovascular exercise is as great as doing an hour when you interrupt it and you're doing it just at the same pace. You're not going to move from there. Your body will get used to the same old routine you do 6 or 8 weeks. If you don't change it, you're not going to see any changes and you're going to plateau. This happens all the time. I hear it all the time with my patients. Well, I lost a few pounds and now I'm stuck. Well, what do we need to do? Did you make any changes with your diet? Did you make any changes with your exercise? So continuously, you have to see what fits your schedule, do it, what is convenient do what it's convenient for you, and stick to it. Don't go backwards. Don't get frustrated. Go ahead and continue it. If you're doing your drops before your meals, your appetite is going to be curbed. You're going to have more calm sitting down and eating what you have to eat without eating too fast, without sneaking into a big meal, and you're going to feel good about it. What else you need to do? We have the Restorix. People don't like to take the green powder because they think it looks icky. Well, it helps immensely, especially if you're trying to fit that half an hour of good cardio, strenuous, and do strength and your weightlifting so you burn the fat, you get that muscle mass growing. You need to recover faster, and Restorix is what's going to help you doing that. And hydration, of course. So you can do it. You have the program that we know it works. You have to stick to it. Okay, let's go to the next slide. What is my diet motivation poster? Well, you know what? There's no food in the world that's going to taste better than how you feel. And if you get up in the morning You're getting out of bed in a different way than when you started the program. Like, you probably started the program, and one of the reasons was because you were having a harder time getting up in the morning. And now you're eating healthy, you're exercising, you're hydrated, you're sleeping better, and you wake up with great energy in the morning. That's worth following a good regimen. You're enjoying your life. You're enjoying activities that you thought you couldn't be doing before. And this is very rewarding. It gives you that positive feedback we all need about the things we're doing. And you go to your doctor, get your annual exam, and you had your blood work done, and you weigh in, they took your vitals, blood pressure is down, pulse is down because you're exercising, your weight is down compared to the previous year, and your cholesterol went down, triglycerides. How do you feel? That is a great feeling. It's a feeling of success. You got it. Then to be able to fit in some nice clothing, different size. As a woman, I'm telling you, I do like that. And I'm sure all of you ladies want to fit in a smaller size. We all do, and men as well. So if you're going to be enjoying your life longer, healthier, and enjoying it with the people you love, but in a healthy way, and you feel really good about it, you have earned a lot by that decision you made a month, 2 months, 3 months ago, whatever time it was, to make a lifestyle change. Well, let's move to the next slide. Success, it's not just about what we accomplish in life. It's about what you inspire others to do. Here we go again. You tell the kids what to do, but they learn more from what you do with yourself. If you exercise and you eat healthy and you lead a very clean lifestyle, that's what they're going to learn. That's what we're teaching them. So you have to do it this way. The only way to do it is leading your life by example. So sounds like the grandpas and the parents would always tell us this, but there is a point that it all comes in together, and we get it. So how do you do this? Well, invite your friends, your family members. There's always a buddy that you can get and pull to work out and exercise with you. I decided to do something this year that it was fantastic, and it has really created this sense of a teamwork in my office. Let me go back. I've had many injuries, as Dr. Mike himself, and those kept me from exercising as much because of the discomfort of the pain. I did gain quite a bit of weight, and I said, I can't do this anymore. So started to get in the program myself, and slowly went into different type of physical activities. I was only cycling as much as I could, and I used to be a runner. 15 years ago, I could not run anymore. So by joining, making the office, the whole office, bought t-shirts so we could compete. We've done 3 5K. We have done cycling races and walking races. We have done so many of those. Everybody's pumped up. Everybody's eating healthier. And the whole group at the office is doing something for themselves and each other. And at 3 o'clock, when all the energy starts to go down, we do kind of like 20 reps. We do modified push-ups. We do wall chairs, planks, and we get back to work, and a few burpees. So 20 of each, and you know what? Energy goes up again. Everybody is pumped up, and we finish the day really good because that will pump your blood for a few hours. So get everybody involved, and you will see that you will succeed. And success does not depend on anybody else. It depends on you, and you will make a difference as long as you reboot. You may fall once in a while and not do things. You may break, the diet one day. Okay, I had Mom's pumpkin pie. Well, the next day, like Dr. Mike has said, lots of water, get your apples in, get your Restore eggs, get your lean protein. You're going to get it. You're going to get it. Nobody's perfect, but you are the only one in charge of your success. So I encourage you that watch what you're going to eat for the holidays, get your veggies in, get your protein, drink plenty of fluids, stay away from the sugary treats and heavy liquor, and you will be able to accomplish going through the holidays with minimal damage. I hope that works for all of you.
No, that was fantastic. It was great, and I love what you were talking about as far as getting your office doing things with you. The minute I had an accountability partner, and my accountability partner was my mom, because I would cheat on myself. You know, I would do things or sneak little things, and I really wanted to try to stay on the wagon. But when I had an accountability partner, and she knew the same thing in me, our results were incredible, and it became more fun to have that buddy that you could lean on. And then that turned into a group, and then now look at what's going on. So I could not agree with you more of the dynamic of what happens when you have someone in this with you. It just makes it completely different, a lot more fun, and you tend to really get better results. And I think it's because of that accountability. But the success rate of everything that we do, it does depend on you. But here's the great part, is you could do multiple cycles of MyGreat28. That's what I had to do. But shoot, I would trade them for anything in the world. So, Elvira, you are such an inspiration to so many. Having met you and seeing how physically fit you are and what you're doing to inspire others is just awesome.
Thank you, Whitson. You know, it's true. We have to continue. More. I do have myself more MyGreat28 series to go, and it's okay, because this is not a race that we're going to stop at any time. This is something that we all should continue forever.
Exactly, and that's it. It's now my life. It's now a lifestyle, and I'm just so thrilled to be a part of something that really helped me get control of myself and control of my health. I just didn't think that was possible. And with all of this, you're going to take all of this that you got tonight and weave it into your next week, and everything that we've got going on. And then next Sunday night's going to be a lot of fun as well. And we're going to keep on continuing on, and I just appreciate everybody that joined us tonight, everybody on the health panel, putting this amazing presentation together, and I just appreciate all of you so much, all of you listening, and we are going to sign off. Have a wonderful evening, a fantastic week. Be very, very safe in your travels, and we will see you on the next MyGreat28 next Sunday.
Okay. Good night, everybody.
Good night.
Good night, everybody. Have a great Thanksgiving.
You too. Good night.
Good night.